Get started.
Okay.
Overview. Thank you everybody that's here today. And this is like our last sort of event for the Ideation series that we've done in spring. And my name is Ankita, for those of you who haven't met me. And that's our HBN team, Janita, Jane, who else is here? Amy, she's our president of HBN. And what the purpose of today's workshop is, it's very informal, and we want to really sort of stimulate some ideation, and I have a little handout there. And I'm going to first give an overview of our program and what we've been doing and what the goals are. So this, many of you have already seen this. It's also in our newsletter. Essentially, it's really a quick flow of what this EMP, which is the Entrepreneurial Mentoring Program structure. And so what we have is, what we're trying to do here is get a group of mentees who are all Hopkins trainees, and are set up mentors together through HBN, and we're trying to set up this mentoring program where there are two key components. One is a series of workshops like the ones we've been having, and the other component is going to be a one-on-one matching of mentors. Potentially, the hope is with all of these events and matching online mentoring, some of you guys will have ideas and take it to the next step of being a startup. So in the bottom is a list of who our mentors are. And so we have a list of people that are who are entrepreneurs in biotech, in the biomed, healthcare, IT, and various other social enterprise, as well as we have mentors from the Tech Transfer Office here at Hopkins, and a group of venture capitalists from local Baltimore area as well as the Bay Area. And in addition, on the right are listed our affiliations with of these mentors. They're either JHU alumni, and we're working with our mentors from different student groups around campus, like Innovation Factory, the Care School of Business, and Social Innovation Labs, Tech Transfer. Again, that's our team. So our goals really are two. One is the educational goals for today, and also throughout. It's going to be like generation of ideas, and how do you evaluate the feasibility once you have an idea. And then taking it further in a series of workshops that we're going to do either at, I'm thinking in the fall right now, are going to be learning how to generate a business model using the business model canvas. And then eventually we want to also learn how to pitch ideas to for funding. And really the other goal here is to do networking, which would hopefully facilitate interdisciplinary team building, and I don't want to go too much into this. So this leads into what we're doing today, which I have in the handout, which has come out of the first two workshops we've done, where we've discussed what are the types of ideas you can come up with, and how do you test their feasibility. So like in the first workshop, some of you, I know in this audience were there, we've discussed, like what are the two broad spectrum of ideas. One is market pull, and the other one is technology push. So since it's like a small group today, what I'd hope to do is have the discussion leaders really moderate the session, but we had, as a team, we had thought, okay, we'll just open it up to the audience and ask who has an idea. If anybody has an idea, then we'll use this template to go through that exercise. So that was our goal. I guess we should do that, Amy? What do you think?
Yeah. So, for those of you who are here, is there anyone who's currently working on any sort of startup idea, or are you, just, raise your hand and let us know why you're here, even if you're not. Like, maybe we should just go around the room and all introduce ourselves anyways. So, I guess I'll start. Since Ankita already introduced me, but my name's Amy Anderson. I'm a fourth-year CMM student and the president of Hopkins Biotech Network. I am not currently involved in any sort of startup venture, or nor do I have any fantastic ideas for one, but it's something that I'm definitely considering as a career option. So that's why I like to be involved in these sort of events. But anyways, can I go next?
My name is Jing Yu. I'm also a PhD student in the third year in Hopkins. I'm interested in more about the tech transfer part, so that's why I'm very interested in this workshop series. go to a speaker or something.
That's fine. I am too.
Right. Okay. No, I'm PhD here in biophysics. I have some ideas to create. Well, I have ideas for developing here. Basically, I have my own entrepreneur in my country, but I want to put some ideas here, developing ideas here.
I'm Wei Zhang, and I'm a postdoc here at the School of Medicine. So right now I'm thinking about the possibility like a transfer to industry in the future after the postdoc training. So I don't have any startup plan right now, but I want to look for like what other possibilities, job opportunities that I can explore and maybe be able to integrate what I'm learning or train more to like apply them into the industry development. Yeah.
I'm Megan Weller. I come from the Tech Ventures office. Part of my job is to work with business development and create with Dave's group some partnerships with industry. The other part of my job is to really grow our network, and so that we can take any idea that comes up and create the best possible outcome for that startup or the research that's then disclosed. My background is in actually sales and marketing, and I had been running a company that was a logistics company for the past couple of years. So I've been in startups. I've had to pay people to work for me and pay my taxes and get contracts signed and all that kind of stuff. So I have a bit of background in that, that's that. So I have no PhDs, nor do I have a master's or anything like that. So lots of life experience.
All right. I have.
Let's go finish with the introduction.
Yeah, that's fine. I can. Kunal, I was going to say something.
So my name is Kunal, Parikh. I'm a PhD student here at Hopkins in biomedical engineering. Before I came here, some experience working on biotech and then also a nonprofit, for-profit social enterprises.
I'm Vijay. I'm going to graduate end of this month from the pathobiology graduate program, and here out of Boston. And we just started a company with two of my friends in my program on a vaccine that was developed here at Hopkins. So we just signed.
You just did the ICOR program, right?
Yes, we just did it.
Very
And we
good.
signed the option with Hopkins in April. And we just started on this journey, and there's a lot of things to learn. And just speaking to Kunal for like 5 minutes before class started, there's two things that I realized I didn't know. So yeah, it's going to be a good long journey.
So my name is Dave Greenwald. I have a PhD background in genetics, and while I was up at Tufts in Boston when I was doing that, and while I was earning my PhD, I started a company which I successfully raised money for in 2011, and then actually ended up selling the company at the end of 2013. So I've kind of been at it from very early stages of, is this a good idea, to like, how do we validate this, to who do we raise money from, how do we do that. Then, when you actually raise money, sort of pressure's on to actually build a team, build products, and sort of create value more than anything else, and then ultimately exit the company. And after selling the company, moved down to Baltimore. I've been teaching part-time at the Carey Business School, Entrepreneurial Finance. And so that's really specifically looking at like how you raise money for companies and sort of what are the terms. So talk to investors who sort of know enough to be dangerous. And honestly, if you know the right words, it will probably increase your valuation just a little bit. So that's worth it. And recently joined the Tech Ventures team. I work with Megan. And really, they're actually very similar, like in a sense, like half of my time towards how does Hopkins work with big pharma and biotech, and then the other half, how do I focus, how do we help get startups and things come off the ground in the best possible outcomes. So, and then I'm also the Carey faculty advisor for HBN. So more than anything else, please view me as a resource. If you're starting a company or if you're have questions about entrepreneurship, I'm more than happy to help advise you.
So my name is Martin Borja. I'm a medical doctor by education, but instead of going the clinical route, I went more the business route. And I started my own company. It's doing pretty well. But after about a year and a half, I was recruited back to Hopkins to help with some of their healthcare IT ventures. And so I still have the company running. I have this job, and I'm trying to keep the company afloat and really build the company because it's really got a niche market. But you know, I need to find resources and find information to keep it going, and where to spin it off from there because it's got a lot of potential. But I got to figure out what how to do that, and the right connections.
So I'll introduce myself.
Yeah, that's right.
Okay, yeah. I'm Jay Thier. I'm a grad student up at Hopkins. I technically work at Carnegie with Akita, and my project's kind of looking into lipoprotein metabolism with a focus on like drug discovery and reducing risk for heart disease. Very new to the entrepreneurial world, no background there, but that's why I'm here.
Before I introduce myself, I'll invite everybody to the table first. You've been standing for a while.
Yeah.
I'm Janita. I'm a postdoc in the radiology department, and I actually got involved in entrepreneurship by fluke, I would say, because I participated in the Neuro Startup Challenge, and according to the for the challenge, I had to build a team to make a business plan for an invention that was released by NIH, and during that process, so in the challenge we went through making the business plan, going through many inventions and figuring out which would be the best one to start up. So in that process of working on the business plan, making the financial model, it was a very nice experience for me, and I want to delve further into it. So even though that was a theoretical business plan until now, but we are looking forward to maybe licensing it at some point, but we'll see. But that's how I got interested in entrepreneurship, and then I met Ankita and Amy and Jing, and I saw that this was here, and I thought this would be the best way to carry forward my enthusiasm. So that's why I'm here.
Okay, since it's a small group, I also sat down because I was just like, so what we plan to do here, I guess, was to really, we've all introduced ourselves, so I think we had thought originally that we'll see if anybody has an idea that they want to explore, and maybe the discussion leaders can feed into how to take it to the next step. That was kind of our thought. So is anybody here in the audience willing to share
It
their
sounds like these two.
knowledge? Yeah.
I mean, it might be cool if you guys maybe spend like 2 minutes just talking about, like, in a nutshell, what the company is about, and maybe we can use those as examples too.
Oh yeah. So the vaccine that we're working on is on human papillomavirus vaccine. So currently the current vaccines in the market right now, there's a newer one that covers 9 strains, but that only covers 90% of the cancer-causing ones. Ours that was developed here in collaboration with another collaborator in Vienna. It covers 100% of all cancer-causing types. So it makes really a difference because if you think about it, when you have a vaccine, no one ever thinks about it. There's no other vaccine in the market where you still need screening after getting it. Like with measles, with any other vaccine, with Hep B, you don't have to get screened for it. It's because the vaccines work, and the current vaccines out there are just not adequate enough. And so what we're trying to do is because it was developed here, we saw the potential in it, we licensed it, and then we're trying to identify the niche market, identify the strategic partners for us to bring this to this full commercial.
So if I can, so going on with, so it looks like your idea fit into the thing of you actually had a product and you were trying to find an application. So how did you what I'm trying to get across here is how do you come up, you probably had something going in the lab, a discovery that you thought, okay, this can become a product, right? Versus a random thought and then you're trying to find, I just want to know how you guys came up with the idea, if you can tell us a little bit about it.
I guess that's how, in Hopkins, we have really a lot of smart researchers, and, good research always addresses a problem. And you know, with vaccines, the issue here is the current vaccines are not good enough. So it's as simple as that. And it's really, you know, but along the way when you think about it, you'll be, you know, currently the market, in terms of competition, currently the market has like Merck and GSK. How are you going up against Merck and GSK as a startup? You know, what is your business development plan going to be? And you know, at the end of the day, I mean, you think about all these, you know, all these criteria, but you need to believe in. So one really good advice I got along the way is, don't worry about the science, because for a lot of startups, they feel when startups don't work out, it's not because of the science, it's because of the team, it's because you don't have the belief in your product. And because and having gone through the iCore program, it's startups are simply entities looking for a business model, and it's always about pivoting, you know, and talking to customers, knowing what they want, instead of us being in the lab, assuming that, you know, maybe the market, right, assuming that the market wants 100% protective vaccine. It might be wrong, because you have to go out to market and talk to people about it.
How was the outcome of, so the iCore program, I don't know if we're all familiar with it, it's a National Science Foundation program that essentially takes your idea at whatever stage it is in, probably late stage, a product's been developed, or you've got a business plan that's pretty well defined, and then you are tasked with interviewing potential customers, clients, funders, and manufacturers, right?
Everything.
Everything.
Yeah.
And so the original program for iCore is like a 4-week process, and you're supposed to make like 1,000 calls. What we've done is we've actually condensed it down into a 2-week process where it was like 25 to 50 calls. And so can you talk to us a bit about what you found out from those calls?
So it was very helpful in validating our assumptions, because so for us, you know, as a vaccine, so you know, logically we talk to people involved in vaccine regulations, people with experience with the FDA, with the CDC. You know, for us, within the first 5 interviews, we finally had an idea of what the value chain was going to be. Because, you know, as researchers, we always thought, you know, get a good product, FDA, go for clinical trials, FDA approve, and then you're done.
Right.
But it turns out that there's so many other different parties involved. You know, for us, you'll be, you know, getting a product, going through making the GMP grade, the clinical grade vaccine, doing the testing, getting the FDA approval to even start clinical trials, going through 1, 2, 3, and then, you know, or maybe getting a strategic partner. Once you are done with that, then once FDA approves, then you have the CDC recommendations for vaccines, and then you also have to talk to the pediatricians, you also have to talk to the parents. So, you know, going through this process, we always thought that, when we first started, we always thought that the parents were the most important party. We always thought that, you know, with HBV vaccines, you know, and with a lot, there was so many, our assumption was, parents always think of this as an STD vaccine, so they won't want, and that's why they don't want their parents, they don't want to give it to their kids. But talking to parents, it turns out that, you know, they listen to whatever their pediatrician says. It could be that, you know, we are biasing because we're only talking to people in Hopkins, you know, around this network, the more well educated. But it turns out that, you know, parents listen to pediatricians listen to the CDC recommendations. So then you understand which party you have to talk to. In terms of, and for us, it matters to us, because even though we're not bringing this to market, you know, at the end of the day, you have to formulate a product that big pharma will be interested. And the value comes from, you know, knowing who are the critical parties that evaluates it, which to us will be the CDC, the FDA. And then it comes to, you know, designing clinical trials, how you should design it. So it's really a very helpful process, and it's only just from 25 interviews. So, you know, right now we're applying for the national one, which is 100. But I think, you know, as researchers, I mean, one advice would be, you know, even whatever you're working on, you will see the value. There has to be value in whatever you're working on, because that's what we're doing research for. And it doesn't, and don't just restrict yourself to, I'm going off tangent, but don't just restrict yourself to whatever you're interested, whatever you're working on. Like, I work on cancer epigenetics, which is way different from HBV vaccines. But, you know, if you see the technology, if you're interested, spend some time looking into the commercialization potential, and who knows, you know,
think and we talked a little bit before this meeting about kind of some of the topics here, and I think it's really important what he's saying about like talking to different stakeholders, and especially early on. And the truth of it is that most ideas at some point you'll find a reason to kind of kill an idea, right? And it's sort of contradictory to what all entrepreneurs tell you, which is you need to be 100%, you need to run through walls, and that's all true. But at the same time, like I think there's sometimes when you realize there's a problem here, and it's going to cause major problems either to get funding or at some point down the road, like this has to be addressed. And if you can't kind of relatively quickly, like devise a way or see how another company has gotten around that problem, it might give you pretty good reason to sort of evaluate, is this the right opportunity for me to kind of put all my heart and soul into, or should I kind of move on to the next one? And I think one of the things that you mentioned, which I'll let you discuss, is sort of the spiral thing, because it's along these same lines of kind of talking to different stakeholders early on, and then sort of taking that information to kind of evaluate, like, what are the, like, every entrepreneurial opportunity is going to have issues at some point. It's just a question of knowing, like, are they surmountable or are they like impossible? And just like it's gonna, if you're gonna outcompete GSK and Merck, like that's pretty hard. If it's more like, well, we really need $10 million, it's like, okay, like you could probably find that money somewhere. Like it might be hard and take a long time, but like you can probably do it. So, do you want to talk about the spiral?
I think it all comes down to at the beginning is that when you're a first-time entrepreneur, you don't know what you don't know. Even if you're a second time or third time, you still don't know. And so, I think the whole point of the I-Corp is so valuable. So, my first company, we went through the first iteration of I-Corp program with NSF, and that was hugely valuable. And we made an entire pivot in terms of the application. So we were on the side where we had technology, and we had no idea what to do with it. And so, an I-Corp program really allowed us to understand where is the market for it, who's going to pay for it, and why would they pay for it, and like where are we unique compared to other platforms that are out there. But in terms of the spiral model, I think two things are: one, getting information, really understanding your value proposition, but then two, I think it's just like fail fast if you can, right, and spend the least amount of time and the least amount of money to get to that point, right? So the spiral innovation model is something developed by CEP, the Center for Bioengineering Innovation Design here at Hopkins, and so they break it into 4 stakeholders, right? So there's your organizational stakeholder, it's like your lab and your team. There's a clinical stakeholder, it's like an actual clinical problem. There's a technical kind of stakeholder, and then there's like the reimbursement in the market and those sorts of things, right? And so what they say is that you can start in any one of those. So you can start with the technology, you can start with the organizational imperative, you can start with the clinical need, but never go too far in development without touching base with the other part, the other stakeholder, right? So never, the original bench to bedside was, we're going to develop this technology for 12 years, and then we're going to see if someone wants it, right? And so that means you wasted $10 million for, it has this, polymer in it that we can't use, right? And so I think that the spiral innovation model is a better way to kind of understand those things before you wasted those 12 years and $10 million.
And as you go down this process of like having all these phone conversations, like you can basically, like, if you learn something from somebody in regulatory, be like, I wonder how that affects, our manufacturing timeline, right? So then circle back with, and that's the other thing I would say, which is just kind of good advice in general. It's just like everyone that you talk to about your startup, you should be building a longer-term relationship where you can always go back to them, right? And the way to do that is to kind of put yourself in their shoes and sort of say, like, what's this person going to get out of this? Like, they might just be interested in the technology, or they might want to, they might play some role at some point. But I think whenever you do these interviews, it's always helpful to sort of try to build a little bit of a relationship. So again, you can always go back to that person 6 months from now. And I think, even when you finish up like those phone calls, just even say, like, really appreciated your time and advice, would love to come back and give you an update if that's okay. And everyone's going to say yes, which just kind of opens the door to, kind of continuing that. But meanwhile, you're sort of building a bridge where if you learn something 3 months from now about how the FDA or CDC is going to react to this, you can then pressure test that back with your, other stakeholders.
In this thing, in our recent I-Corp thing, we had one team who could have just said, we're not going to do this. This is a fail. There was that one team that was they just didn't say the words, and I wanted to say, just say it. Just say, this is not the idea, we're not going to do it. And they just didn't. But they knew, they said it every other way, to just say, we found out that, and it was a product that came out of CVID. It was an idea that they saw a clinical need, and in the end, the need was truly just more training of nurses, and that would have solved the problem like that. So they went through this whole process to find out that they needed to find a different idea, and it's that same idea. It's fail fast, fail cheap, move on, and that's exactly what they did.
And it's hard because as you put time and effort into these ideas, you become emotionally involved, right? So it's like the further down you go, the harder it is to kind of back away from something.
And that's where I think scientists are actually, like, you guys are good entrepreneurs because you look at data, right? And like you can be objective most of the time. And I think that's really valuable. Just look at the data and look at what it tells you. Look at what your customer interviews tell you, and then go from there without putting too much emotional.
Yeah.
Oh, that's really hard to do.
It's very, very hard to do. I think for us, when we first started out, we had such a bad rap within Hopkins because we were pushing back so much against all the all the really people are trying to help us, but we're like, no, we think this is great. We think that the market is going to want something that protects against 100% of HBE types. You are wrong, and then it's just, and you have to realize that people that you talk to, no matter who it is, are potential connections, potential resources for you down the road, and it's so be ready to pivot, and if you can't pivot, be ready to accept the fact that you might have to drop it, and that's even if you've put in so much time and effort. I spent 2 years on this. During the time my co-founder left and came back in, and then it was bad. But going forward, it's going to be equally bad, if not worse. But that's just how it is.
And there's two other things you just made me think of. One is I would disagree that even if you spent 2 years on this, and even if it doesn't work out, it's not like those were 2 years that weren't well spent, because think about how much you've learned in the process, right? And it's all about, I was saying this to you earlier, when I did my first company, I made 1,000 mistakes, right? And the idea is that your second time around, you make 850 mistakes, right? And then you make 500 mistakes, but you're still going to make tons of mistakes. And it's a process, right? So you're just supposed to kind of get better at it. And so I just think that even the process of going through this is helpful, and you learn along the way. The other thing is the importance of advisors. So the tough thing is, how do you know when something is absolutely insurmountable, this is a deal breaker, or if that's kind of you got to think about that, but you might need to find a workaround or some way to sort of solve something. And I think that's where kind of experienced entrepreneurs who've kind of gone through this can help you sort of say, that's a big problem. You should really think hard about this, kind of saying it nicely, you should probably drop this. Or if they're just oh, well, maybe think about how this company did it, or, kind of different examples. So I think there's a real value, again, and those could be kind of formal advisors if the company's a little bit further along, or they could kind of just be informal people that you sort of keep in touch with. And then the other thing I was going to say, just very briefly, is that the whole process is can be long and challenging, but I think that in the end, it's again sort of you'll be better for it. So it's worth putting the effort in.
The other piece is putting those guys on vesting agreements, which we talked about.
All right. Yeah.
Too, right? So the founder that left for a while and came back.
Yeah.
And we talked about this.
It was so uncomfortable.
Yeah. So that point is really it's a good point too. It's just kind of one of those things that you don't realize until kind of after the fact usually, and it's just good advice to just have, which is that even founders of companies should probably be vesting their equity over time. So and I'm guilty of this too. So in my startup, my co-founder and I were both graduate students, and it was 50-50 down the line, right? That makes sense. And so, a year later, he takes a job on Wall Street, he's making tons of money, very not really involved in the company, and I'm, burning newspaper for heat in, an incubator, and then trying to raise a Series A, right? And yet we still have the same ownership. So it creates a tension. At the time, it seems like the right thing to do. Let's split it 3 ways or split it 4 ways. And it's too early to say kind of who's going to be involved at what stage. But the best way to do it is just to say sure, right now there's 2 of us. We can split it 50-50, but the equity is going to vest, meaning that you don't get it all at once. It's you get it over a 2 or 3 year period. So if you're still with the company working, doing X, Y, and Z, then you get equity comes to you over time, as opposed to sort of having it all at once.
I think it goes to Kunal's, it goes back to Kunal's point. You don't know what you don't know, and if you come to this thinking, oh, you know what, I've started a company, I'm awesome, I know everything, you are going to get into a lot of trouble. Yeah, and it's really about, you know, how do you get mentors? It's really about being humble and being willing to learn from people, understanding that you don't know everything. Yeah.
So what are your next steps?
Right. What has been your like major challenge so far? You say you're 2 years in.
So for us,
like what point in the approval process is your product anyways? Like have you are you dealing with the FDA right now, or are you not there yet? I'm curious because I've been working on an IND for a while, so I'm kind of like.
Well, I mean, we are looking into going to clinical trials within the next 3-4 years.
Okay.
Yeah, so I can say we've gotten some funding that can get us there, some really substantial funding from the NCI that can get us there, which is why we're so committed and we're so confident that this technology will work. You know, and I think for us the biggest challenge, and it was so I was reading up the HBN blog before here, and then I remember there was an interview, and one of the same question was asked to that guy, and the answer was, you know, assembling a team, assembling a mentor, someone who is willing to advise you without asking for equity. And you know, we have talked to like 50 over people, and then like 30 of them will be the first meeting is fine, and then in the next conversation you'll be, oh yeah, great, I love to help you guys out. By the way, my hourly rate is $400 an hour. Yeah, you know, so it's but you just have to keep going, and you know, along the way we found really good people we can leverage on, you know, and I'm pretty sure that, you know, like even within this short 2 years, whatever we had 6 months ago, it's a very different set of mentors. You really have to, you know, if someone is not working out, you just can't move on. You always have to keep looking for people you can get advice from.
So I have a question on that. So I know mentors are important, but how do you go about finding mentors, and just tell us a little bit?
It's really just.
Is it a numbers game? You just like go through life meeting as many people as possible.
It's I mean, if you're working in a lab, if your PI has some connections, ask them to give you the introductions. If not, you know, tech ventures can be a very, very good resource. I mean, at that point in time, because I think because we were negotiating. Albie is our MII site miner, yeah. So, but we were negotiating with Elizabeth. Yeah. So I guess that was I don't know how, like we did.
I think you always have to be on the lookout for good mentors, but then there's also sort of like hotspots. So for instance, like going to a meeting like this, or going to MII, like you'll see, there's programs in place that if you attend them, it just takes time. Like there's not, I mean, that's, the truth of it is that like it just doesn't happen all at once. But then there's also things like MERL, which is like the Maryland Entrepreneurial Resource List or something like that, and that's like people who basically are offering to be mentors to startups, right? And say like, I have expertise in oncology and infectious disease, right? And so like, it sort of depends what you need, but like, and then the other thing is when you do start networking, going to these events, like if you can get good at like a good elevator pitch, like 60 seconds, like this is what I do, this is what the company does, even if I'm not the best mentor, I'm gonna say, you should really talk to Megan, you should really talk to somebody else. So like, a lot of it is kind of that face-to-face interaction, and then just doing stuff, like innovation factory events and business plan competitions. Those are all great places to sort of like run into mentors. But you got to get out there, right? Like they won't come to you. It's very unlikely that they'll come to you. And more likely is that you meet somebody. And at least for my company, like once you start to get an advisory board formally assembled, they can also be a source of sort of like, sometimes they're like, oh, it's a friend of mine, but he's good, he's relevant, and they might propose people to be brought in.
One of the things, so I manage our Mentors in Residence program in Tech Ventures, and one of the things that, the 3 outcomes that we have as good outcomes of the program is just great mentorship. Second is that the mentor may potentially invest in the company. And the third is that the mentor may actually want to take over the company. So you sort of look at it like, okay, so if you were to think about a recent, let's look at a case study of the guy who just sold his company to, was it MyFitness? The guy sold his company to Under Armour for $150 million. How much did he potentially make out of that deal? Maybe 10?
Are you MyFitnessPal, the website?
Yeah. Yeah. So, you know, he started out with an app. That was a pure app. He went down the path of, you know, getting investors and giving out equity as he went along. And truly, it's an app.
Yep.
I mean, it's a robust app. It's not like he had a million people working for him. He probably had a really good team. But over the course of time, you know, he probably made $10 million on that deal. $150 million, he sold the company, he probably made $10 million. But he would never have gotten there if he hadn't given away equity, and if he hadn't brought people on board who were willing to invest and take a big chunk of that company. In the end, he made $10 million. I mean, it doesn't sound like, oh, but he sold it for $150.
Right.
You know, he made $10 million, and he's going to turn around and he's going to do something else.
Yeah, the expression is like you can either be rich or king, but not both, right? So like I've run into a lot of entrepreneurs and a lot of faculty members, quite frankly, at Hopkins and other universities who want to be king, and they're like, "This is my company. I don't want to give you 0.25%. Like that's my equity." And it's like you can own 100% of something that's zero, or you. But again, I think that most entrepreneurs who end up on that side of the equation own like less than 10% of the company, but it's worth $150 million, right? So it depends. Like, and that's, I mean, we're kind of drifting into sort of the kind of financial outcomes of like how to play it, but with your first startup, assuming that this is most people's first startup, like you probably need more hands-on advice from really good advisors, and you're probably, you know, because you're just less experienced. So like your first startup, you're probably going to need to bring on more advisors and give up more equity for straight up advice. That you're also going to get diluted by investors. You know, that's going to happen as well. But maybe your next, you know, it's a long life, right? So like your next startup, maybe you'll need a little bit less. Maybe you'll find a way to do it a little bit more cash efficiently. And so like, you know, it's very common for, I think, or let's put it this way, it's very rare that on your first startup you're going to hit it out of the park and own a ton of it, right? It's more likely that your first one you kind of have like a, you know, solid double, and then, you know, your next one is even better, and eventually kind of build up to hopefully do something. Like there's serial entrepreneurs who I imagine make like $10 million on their first deal, on the first company, $50 million on their second, and then, you know, $300 million on the third, and then they're done.
Then they're done.
Yeah, you take vacations.
Yeah.
Question: what do you do first? You create a company, and after you patent your idea, or before? Because it's a question for you. For a vaccine, it's very complicated. If you think in a vaccine, maybe you have the idea to create a vaccine, but before that, you need to at least prove the concept.
Right.
Because the vaccine is very complicated.
No, so
with mice, it's okay, but at least you have a phase 1 with monkeys, at least. And after, you say, well, maybe I could apply for a human being. Because it's not, it's different like you take a gentamicin or neomycin, a drug.
Right.
It's totally different when you apply for a vaccine. Vaccine is different. That is one kind of product, one kind of market. But the other market is my market that I want to apply is about technology. Technology is something that I don't need FDA, but I want to create something to maybe Hopkins use. But the question is, what is my idea? What I do? I create first the company without any kind of money. And after say, well, I have the idea. Who take it? Who put money? So it's different.
So there's no way to, I mean, you,
how is the experience?
You have to, there's a checklist of stuff. I mean, there's not like, it's not a secret. Like if your goal is to raise capital to develop a product, right, which is kind of a very broad definition of a startup, there has to be, I mean, there doesn't have to be IP, but like usually there's intellectual property which is licensed to a company, Like that's just a tip. I mean, so you kind of, those things need to happen. What comes first? I mean, lots of times IP is generated and then is like, I mean, if it's generated at Hopkins, you can start a company and then license it from Hopkins, right? If you have an idea kind of independent of your work at Hopkins, I mean, I don't know, I mean, you could start a company outside of Hopkins, and if you, my understanding is that if you develop the IP completely like kind of off campus in your spare time, then it can be fully assigned to that company, right? But it's sort of,
there's a couple
nice.
different funding mechanisms within Maryland that benefit you if you do not start an LLC, if you do not license your technology before you apply for this funding. So there's, I know we're going completely down a different path, but this is, I mean, that's good information, right? So if you want to apply for a bunch of different grants, you cannot be an LLC. And the IP cannot sit within that LLC, but you can go down. So the MII program starts out with it is just a disclosure. You have to disclose, and then you can apply for $100,000 for research. The intent is that that research will bring you to the point of licensing, and then that's the phase 3. So the phase 2 is sort of like a bridge loan, like not a loan, but like a bridge grant. There's a very finite timeline on that. So the phase 1 is pre-license. You cannot have an LLC at that point. But to get your phase 3, which is another $100,000, I think, it may be more. I'm not sure exactly what the threshold is. You then have to be, I am buying this disclosure, this license from Hopkins for my 2%. And then you can get that $100,000, and then you continue on. And as a matter of fact, Hopkins, for this TEDCO, this is Maryland's technology.
commercialization.
It's like Development Corporation.
Yep.
Entrepreneurial, maybe?
There's an E in there
yeah,
somewhere.
right? So that program has a bunch of different grants, and they've got technology. They've also got the biotech stuff. They've got cyber, all sorts of different levels. So before you start an LLC, you want to look into what options you have from a funding standpoint. That these are grants, so you're not giving up. It's not a loan. You're not going to have to.
It also depends on what kind of technology it is, right? So since this is like the Hopkins Biotech Network, I was kind of assuming that we're mostly going to be talking about like therapeutics, vaccines, et cetera, maybe diagnostics. But if you're going to do an app or technology, or I mean, like mine was like a software platform. Like those are different, right? There's different amounts of capital that you need to raise. You might be able to get further. I mean, like for instance, with my company, like we were able to sell the product as a beta version and get revenue, which then funded our R&D, which is a lot different because our R&D costs were 10 times lower than it would be to get a drug to IND. So it depends on the type of technology and stuff, and that sort of informs how you incorporate, when you incorporate, and then what funding is saying kind of is available to you. So it might actually be useful to hear because it sounds like yours is different than.
Yeah, mine is completely another field from all this tech and bio. So I actually created a staffing company, and it was out of a need that I saw, through medical school and through all my contacts back here at Hopkins, and I noticed, what was coming down the pike, and it was big data. And I noticed that big data was starting to filter in to all of the hospitals, and they had to. CMS was mandating outcomes reporting, and knowing that the clinicians and the nurses, they don't have the time to sit down and report to the degree that these registries wanted it, and CMS wanted it, Medicare wanted it, Medicaid wanted it. I formed a little team of physicians that we outsourced to do the clinical reporting. So we did the data mining. We also did the actual physical reporting back to those registries, because it took a clinical mind to actually pull this data. And they, when they're mandated to do it, they're also paying to participate in this, because they got reimbursements and everything was, their performance and their ratings were based off of how well they did, it was very important for the hospital to participate and do well. So they couldn't have their tired residents doing it. The nurses didn't want to do anything above and beyond their taking care of the patients. So they found that, you know what, outsourcing it was a viable option, cheaper, and at the end of the day, we let them loose when we're done, or we kind of find someone else to slide into their position full time. But that was it. It was kind of identifying this need and knowing some people, and then it kind of built, have a couple clients that really pay well, and you know, the staff is physicians that, you know, want to work part-time, or I have residents that want to put in some moonlighting hours, or other residents that don't match. So I kind of help those guys out because they're not making good pay as residents. So, but that was it. It wasn't really any kind of tech or anything really cool like that, but it was a need and identified and implemented. But
and I think it brings up at least in my mind, a good point, which is that, you know, how do you know, what I hear as a big challenge here is like scalability, right? So like, you know, it's one thing to say like this is kind of working in a smallish like kind of niche, but like how do you scale this in terms of how big is the addressable market? Not just like everyone, but like really the addressable market, and then how do you scale your internal staff? Because the tough thing about residents, eventually they're not residents, right?
Exactly.
Eventually they are making good money, and they may not want to do that eventually, and so that's kind of, there's sort of like, there's pressures on both sides there. And then the other question is, and this is kind of goes across the board, which is, you know, what's the ultimate outcome of the company, right? Like, and I have every bit of respect for people who are saying like, this is a vaccine that needs to get onto the market, and if we don't do it, who's going to? And it's going to save lives, and it needs to happen. And you know, if I don't make any money, that's okay. I can, you know, it's not a big deal. And then there's other people who are like, I absolutely need to make money, and that's a big part of it, you know, or they should go hand in hand. And then there's everyone in between, right? But the point I was going to make, and this is, I learned this as well, because we had with my company, we did consulting, which was a service business, and then we also had a product, right, it was our software platform. So people would, you know, companies would pay to have a username and password so they could log in and query the system. When it comes to valuations, you get, and this is really important, like with service companies, unfortunately, you really get a much smaller value multiple. And what that means is that, like, if you have a service company where, you know, you make $1 million in revenue, you'll probably be valued at like 1 to maybe 2x revenue. So like your company, if all you do is that, your company might be worth like $1.5 million, $2. If you make the same $1 million, but you're selling product, so you're selling like a drug or a software platform or something that's tangible product, you'll get like a 10 to 12x multiple, depending on the industry, right? But like in general, it's a much better financial play to have a product than a service. And it's because it's difficult to scale service, and it's tough. You gotta train the people to do the work. You gotta, you know, incentivize them, keep them as employees. Like you got that human factor, right? People leave and do other things. If you build a really good sticky product like this app, right? Like that's when you get these really good multiples. So that's just something to kind of bear in mind. And yeah, that's you know, product over service for sure.
Well, I think that's definitely a good point, because I'm not sure I'm using the term right, but we're thinking of pivoting our company.
So productize the service into a product, right? Yeah, that's the right move.
Exactly, because we see our finite, you know, our limits in this company, and we realize that.
And that's actually, that's an investable idea, right? Because quite frankly, like it's very difficult to raise money to scale a service business. But if you say, we know how to do this, and we're kind of like the only ones who are doing it, or with some sort of advantage, and if you can somehow say there's a secret sauce or a patent or something that you can protect, and then you're trying to raise money to then productize that, and then that'll scale, that's sort of a winning scenario.
So what's your plan for that? Do you have any ideas so far?
Well,
are you looking at some sort of online platform for?
Well, it's kind of hard to describe, and it's kind of, I don't know. I feel like it could get me in trouble because I'm going against some of the forces here. So I think I'll reserve it to the next meeting until I develop the idea more and see the feasibility. Because I have to talk to some friends about, you know, intellectual patenting and stuff like that. How can we take our idea and, you know, sell it, you know. So that's one thing, you know, something I find in this group, you know, ideas and information. But next meeting, maybe. We'll see how it goes. Yeah.
But I think like going back to your question, I mean, having gone through the iCall program. So the iCall program was started by like one of the main members was Steve Blank, and it's like one of the challenges that I personally had was, you know, most of like I would like to think that the iCall is more geared towards like a software or tech company when you already have a product or you know what your product is going to look like, instead of a biologic where it takes 10 years for you to get into market with the clinical trials. And so I'm going to speak from like a biologic perspective. I'm not sure how many of you have, and I think it's helpful because, you know, for us, yeah, it's going to take 5, 7, 8 years for us to get to market, and what we are selling is really the value. And you know, we did, and again it goes back to Kunal's point about you don't know what you don't know. And when we started off, we think with the one of the people that we talked to said that you guys have to form a company first to show us that you're credible and to show us that you are serious about it. So we form a company, and then now when we are applying for MRI, it turns out that we can't apply for phase 2 because we are not a year, because it's only applicable for companies that are less than a year old. Yeah, and it's insane because because you all start out because someone said, oh yeah, you guys gotta be serious. So you know, it's really, and the thing is, as a first-time entrepreneur, you don't know anything. You know, you really have to talk to people and then know that, oh yeah, you know. And when someone tells you that, you say, oh, you can't do it because if you want to apply for MI grants, that's how it goes. And if you're doing a biologic, you know, BioMaryland, MI, and TechCo has so many grants that you can make use of. And for us, that when we had a previous meeting with one of our other mentors, he said that, you know, looking at all the different grants, potentially you can apply for up to like $500,000 just from non-dilutive state funding. And you know, when you hear about non-dilutive, it's music to your ears as well, because it means you don't have to give up equity, and it's not just that. It's also about, you know, when you get a grant, it's also credibility when you're talking to investors.
They do want you to stay in Maryland though, so if you move out, you're supposed to pay it back.
Yeah, yeah, that's
the only thing. I think that's like.
This is TechCo?
Yeah.
Yeah.
Yeah. So please, yeah, and we all want you to stay.
Yeah.
No, because
It's yours.
I'm, for example, when I started a company in my country, in Argentina, you don't need money. You just go and sign a paper and say, this is my company. That's it. I have a company. After that, I need to pay the next month taxes, and I don't have money. And so because that, I need to start just when I just sign the paper, I just start to work for have my product in 1 month and try to sell it. If not, I don't start the company. If not, I don't have nothing to do with it.
I mean, then you have to ask yourself, no, what's your
The problem
purpose?
is here in the United States is different, because what I want to do, I want to create a company here and I want to apply for in Argentina for give me more money because I sell my own idea from here to Argentina. The main idea is win money in the same place, in both places. And both places is interesting because, well, it's more cheapest there than here. I make the same product here and put in Argentina, maybe I don't win money. But if I made it in Argentina and I came here with the same product, I win money and I make more cheapest for Argentina. So the question is, well, how I create the company here in the way that the next month I don't need to pay taxes. Because
it's not so here's the thing. So you don't have to pay taxes unless you have revenue, right? So like if you can start an LLC and it's a pretty nominal like fee to do the paperwork, and so like what you want to do is probably have like an LLC. It sounds like probably in Delaware, just because it's sort of very straightforward. It's probably, I mean, it's not super cheap, but it's like maybe $1,000 or something, and that's just to incorporate. Now, it gets more expensive, and I would recommend that you have a lawyer who kind of does it on your behalf, because they'll kind of make sure that you don't, for instance, like make a mistake
if you're going to be selling something abroad. Like, you should kind of talk through the business plan with an attorney. Although, again, like, all in, this should only cost like $1,000 to $3,000 tops. But then once you're done, like, you know, you shouldn't have to pay any taxes the next month. You really only pay taxes on the money that you earn at the end of the year. So I don't know. And quite frankly, and like, to what I think you were saying is, like, you kind of have to ask yourself, like, are you doing this or not, right? Because if you're gonna do it, like, then you go for it, you know, and you drop the money and you incorporate.
And then, like, to answer your question, what I wanted to say was, like, you know, why, like, what's the value in you incorporating a company here? That's the thing. Like, you keep saying, because if you can incorporate a company in Argentina and sell the product here, it's really, at the end of the day, you have to ask yourself, you know.
Well, the company in Argentina is made it. It's now actually, the question is how we start, because we have the money from the state, but we need to make the other stuff. But we need the lab, we pay for the lab. But the question is, well, we don't have people from this company. People from the people from here and my friend start the company just no profit. It's like a no profit company. Just when the first product came out and the timeline is 2 years, well, they start to see money. But we have the money for I don't know, buy this, for buy paper, but don't money for anything else. The question is, well, here is the opposite. He tried to build the company here. After that, he moved to Argentina because it's more easy for in that way. But looking different aspects in Johns Hopkins, I start to see the probability exists a little bit probability that Johns Hopkins be interested about this idea, because it's something that you could apply in just because here is public health. In the rest of the world, the people poor, and it's interesting because it's diagnostic, and it's very applied for diagnostics in cancer. So, well, maybe it could be a good idea. But the question is, you need to make the prototype, and for have the prototype, well, I could have made in Argentina, yes, but take 2 years. And maybe here it just take 4 weeks, because it's simple. That's the question that I need to know, at least here, for make the idea here. I could have made it in my place too, yes, it's true. But the question is, well, in that moment, I have my prototype, and I have the contract in enterprise for sell it, well, not sell it, it's to...
Right. I think you should talk to a lawyer. Basically.
Yeah.
And I think that a lawyer will have the conversation. So by the way, like, they should have that conversation for free. Like, you shouldn't have to sign anything or owe them anything. And explain to them your situation, and they'll be able to advise you, like, yes or no, you need to incorporate in the States, or you don't. If yes, I'm sure they're happy to do it. They're not going to make a ton of money off of it. It's like, it's the same boilerplate form, and they have a paralegal do it, you know. But they'll at least be able to give you really rock solid advice on, you know.
We're going to have office hours with attorneys coming up in this fall, where they'll be at Fast Forward, and you can come in and sign up for office hours, and then you can meet with an attorney. They will start to charge you when you get to a certain point, like when you are, you know. But I think it's, I think the agreement is such that the incorporation and some other basic things are included, and then when you come into, you know, founders equity and different licensing and that kind of the next steps, that's charged at a certain rate. And of course, if you're a member of Fast Forward, that's different. I'll sell you on that.
Question for you, Megan, following up on it. So you said so regarding incorporation, so is the service only available to people that have ideas or technologies that have come out of Hopkins? Or
Ideally. What we will do is we're going to do like an office hour and also like a seminar. So you can come and listen to the seminar and then, and get the general advice and then sit through the office hour. We're going to do the same thing with accountants and a couple other entities that would be helpful in forming your business and getting it
So Johns Hopkins is doing the legwork to kind of get these service providers into one space and kind of put together an attractive deal for early stage companies. But quite frankly, like there's nothing preventing you from going to a big law firm and saying, I've got some questions. Like, you know, it's like any business transaction, like there's a process to sort of like getting the information. So you could, you know, if you don't want to wait till the fall, you
Right.
could go down to Venable or
Right.
deal in Piper or something and talk to them. Some of them, I think the advantage is that like some law firms don't want to do that type of work. You know, some of them are like, no, we represent Pfizer, like that's it. You know, we do big companies and we charge big rates. Some of them are more startup friendly, and like, you know, for instance, with my company up in Boston, there was a law firm called Edwards Wildman who had a program that they called Helping Innovators Thrive, where they deferred all legal fees until you raised money. So it's sort of like whatever you wanted, and that could be IP, that could be incorporation, founders agreements, etc. So that's a really good way to rack up a really big bill.
But as you're creating a diagnostic, that might be something that would go through the MII program. So you would get the money up front before you create an LLC. So it might be something to look into just a bit further before you make those decisions.
No, I will see.
But in the meantime, I mean, the Hopkins has a lot of programs like the MEP. That's why we really started off from, you know, and go there if you have an idea, go there, pitch your idea. Because are there any bioengineers here? I mean, when I went in there, it was all medical products. It was, you know, it wasn't. And I'm a molecular biologist. I have no idea why it takes why you have to put a sand in some pit to cool down a baby. I know it's important, but you know it's not what I'm trained in. And yeah,
it's because we have the same background in some point. But the question is, what you do with when you have an idea with your background. The problem that you don't have is you are not entrepreneurial.
Yeah, which is why, you know.
That's a real question.
Yeah, I mean, I think as you said, there are a ton of resources at Hopkins every single day because of Dave and Megan and the efforts that they're putting in. The Social Innovation Lab, MEP, Innovation Factory, Fast Forward, there's a ton of opportunities if you're really serious about building something here in Maryland and your Baltimore.
Yeah, I mean, so as a very quick example, I was getting my PhD in genetics at Tufts, but I did a software company, right? So it's kind of like, how did that happen? I reached out to the computer science department at Tufts, and I called up 5 professors and said, this is what I want to do. And they all said, you know, you can talk to this person, talk to that person. Turns out she had a postdoc who was graduating, looking to do something entrepreneurial. I mean, like, you know, you make a couple calls, and I would say you should leverage what's at Hopkins, right? Because there's probably, I mean, whoever you talk to is probably a world-class, you know, person. And even if it's not the faculty member who ends up being the person who helps you, they probably have a grad student or a postdoc or a technician who is, you know, probably excited about this type of thing too. So.
And if you wanna, like, your first pitch is going to be bad, like, no doubt about it. Like, even for MEP, we were slaughtered during our presentation, but then you just go from there. And the thing is,